2 years ago, Oregon reported its first case of COVID-19. 1 year ago, sleeves rolled up for the first doses of the COVID vaccine. Now, starting March 12th, the next phase in this pandemic. That's when Oregon and Washington will lift its indoor mask mandates.
I'm very excited for it. I hope everyone's ready. I think it's going to be an awesome opportunity for us to come together again.
Some plan to continue wearing masks in public.
Most likely just because I have high-risk family members and I don't want to get them impacted. And I know there's controversy with it, but I'm just being safe.
Health officials support both perspectives. Portland Public Schools will let students and staff decide whether or not to wear masks starting March 14th. So will Salem-Keizer schools. Other districts are still deciding. And another sign of change? This week, Oregon Governor Kate Brown dropped an order requiring state employees to be vaccinated. She said the extraordinary emergency orders were no longer necessary as we learn to live with this virus. That brings us to a word we've been hearing a lot lately: endemic.
Basically, endemic is it's here and it's here to stay.
Dr. Ken Stedman is a professor of biology at Portland State University. He says the difference between endemics and pandemics is how quickly they spread. For example, the flu is an endemic virus, but it still kills thousands of people each year.
Endemic doesn't mean, we don't need to worry about this anymore. Endemic means that it's not something we have to worry about because it's spreading really fast. It's just something we have to worry about on a baseline level. And what that baseline is not clear.
The level we don't know, how many cases a week or a month or a year.
Dr. Emilio DeBess is an epidemiologist and senior health advisor for Oregon's COVID-19 response. He says how the community responds to living with COVID will help establish that endemic baseline. Choices like getting vaccinated, wearing masks when appropriate, and taking precautions many ignored before the pandemic.
Lessons that we've learned throughout all this is that if you're sick, you stay home, right? If you're sick with symptoms compatible with either the flu or COVID, that you should be tested. The key is that you do not want to be the source of infection for anybody, whether it's the flu, chickenpox, or COVID-19.
If there is one certainty, doctors agree, there will be more COVID-19 variants.
The question is, are those variants going to be a problem? And that we don't know, and we're only going to know when they happen.
That sounds ominous, but I know everyone is trying to stay positive. And again, doctors say it's important to remember daily case numbers have dropped back down to pre-Omicron levels and are still falling. Plus, about 75% of Oregonians are at least partially vaccinated. Add to that those who've had COVID, and immunity levels are high.